welcome back. I am Dr. Chris Tomczak with Health Source.
Dr. Don Massessi, also with Health Source.
Let's talk about progressive rehab. Why people need it.
What is progressive rehab?
Progressive. It's what we do in our Health Source clinics across the country. We are what we would consider to be extraordinarily different from a typical doctor's office, a typical chiropractic office, a typical therapy office. Because what we do is we've pioneered a system called progressive rehab, which we may have mentioned from time to time in some of our videos on the blog. But progressive rehab, what it does is it combines some of the newest and cutting-edge types of treatments and therapies and chiropractic care, and it combines that with some of the newest ways to strengthen and correct muscular imbalances, so that you're treating not just the bones but the whole structure, the muscular system, ligaments, the tendons. You treat everything all together to get a better result because it works synergistically.
Yep.
If you're just attacking, if you're just attacking, let's go back to that analogy we used a while back on cars. If the red light on the dashboard of your car is going off and you just cover it up, you haven't fixed a thing. You can't see it anymore, so it looks better, but the light's still on. It's just covered up.
And bad things go to worse.
Bad things, that's correct. So what progressive rehab does is it takes a look at the entire human being, figures out wherever the problems are, the weaknesses or imbalances, and its primary mission is designed to get you, first of all, feeling better. That's the most important thing in most people's mind. But secondly, make it so that not only do you feel better, but you stay better long term, not just short term. Because how many times when you used to practice, you must have heard almost daily from your new patients coming in saying, hey, I went to this doc, or I went to this doc, or I went to this clinic. I felt better for a little while, and the doggone pain just came back. Nothing got fixed.
Yep.
What was your answer?
That's a tough question to answer.
It's an extremely tough question because you don't want to put anybody down.
Yeah.
But the bottom line is that if you felt better, but the pain kept coming back, I would argue that the problem was never fixed at all.
No, definitely not.
It was only addressed in a minor fashion, just enough to get you feeling better. That's not the answer. If your car is out of gas and you got to drive 100 more miles and you're out of gas and you just put 1 gallon of gas in, it fixed the problem. You have enough gas to keep going, but you can't get to your finish line. Which in this case is getting. That was a pretty good one, right?
I like that.
I just made that one up.
That was solid.
I should have used that when I practiced.
I may steal it. And here's another perspective on it as well. When you look at it as progressive rehab within the framework of Health Source, some docs graduated from chiropractic school 20 years ago, and some docs 20 years ago learned a certain style of rehab. Well, they may still be regurgitating that same style 20 years ago.
What do you mean? Nothing changed.
And so what happens? That's their perspective. Or worse yet, they go to some new seminar and learn some new gimmick that they really don't understand. They've never been trained, and now they're gonna use you as the guinea pig.
And get paid for it.
Within Health Source, we bring experts to us that show us and work with us at the same time that we're reviewing what are the latest and greatest and best new breakthroughs and what works best, and then we go out and we train our offices so that when patients come to see them, they're being seen by somebody that knows what the rehab is, when to use it, how to use it, and how to implement it on that individual patient. Makes it better.
That makes it much better.
Absolutely.
Yeah, that's a key. If you've got a provider that you go to for whatever reason, and it's the same old stuff, it's the same old kinds of treatments that have been around for a long time, if it's the same old treatment that was around 5 years ago, in most cases, in my opinion, it's outdated. Because things are changing in healthcare so fast. There's new techniques, new programs, new discoveries being made. Well, pretty much daily, and it takes a lot to stay current.
Yeah.
But I would argue that your health is worth it.
Absolutely.
My health is worth it. Your health is worth it.
Absolutely.
Yeah, for nobody else than our kids and spouse.
Yeah.
But it is certainly worth it. Make sure you're getting care which is the appropriate kind of care and not the same old stuff that never really seems to fix anything. Understand?
Yeah, that's great advice.
Excellent. All right. That being said, follow us on Twitter or Facebook. You can look us up on the web at www.healthsourcechiro.com. That's CHIRO. Have an awesome day. I'm Dr. Chris Tomczak.
Dr. Don Massessi. Thank you.
Take care.